All right, if we could all find a seat here. This is maybe one of the first times I'm like on time for an in-person event, but I was really excited to be here and welcome everybody. And my name is Dr. Bryan Heckman. I'm a professor at Meharry Medical College. This is actually, I'm about 2 years new into Nashville, but just really excited for an event like this because it really kind of highlights why I moved here from Charleston, which was a very hard decision to leave. But when I found the community spirit and the way in which the collaborations happen here in Nashville, it was really easy to actually transition and come here myself. So it's also really nice to just be in person after 2 years of some webinars and Zoom calls. I'm actually meeting some of my colleagues for the first time after like hundreds of hours of meeting together. So super excited to be here. I want to give a big shout out to Latrice and Tracy for helping coordinate and organize this event, and really excited about what is going to come out of it. And so a couple quick announcements. The restrooms, if you haven't found them, are on the left side there. And then there are also some water and some other refreshments in the conference room over to the right. And I will try to keep it to a nice, quick schedule here, and I want to pass it over to Dr. Gill, Wright, who I've also had the pleasure of meeting for the first time, even though we've had some calls. So thank you very much for all you do, Dr. Wright, and I'll pass it over to you.
Good morning. I want to welcome everyone to the first Nashville Health and All Policies Summit and Collaborations for Better Health. We're pleased to have chosen for you to be here with us today. I hope that you learn, that you network, and share with others while you're here, and that years from now the city can look back on this as a milestone in the evolution of HIAP and all of Nashville. I've got two people I'd like to recognize that are with us today. I have Mr. David Frederick, who's on our Board of Health, and the Chair of the Board of Health, Tanae Franklin. So thank them for coming. Today's summit serves as an introductory and level-setting opportunity to expand the Health and All Policies initiative citywide. Locally, this work has so far resided exclusively within the metro government, but the Health and All Policies frameworks have been used for decades around the world by institutions outside of government as well as within, and we hope to see Nashville move in that direction. The core principle of Health and All Policies is to provide for thoughtful decisions across all sectors of government and private enterprises, based on one simple insight. We all make decisions every day with implications for health of our citizens and city, whether we think about it or not. We want to instill the habit of thinking about it first. We want to learn how to think about it when we do, and then we want to learn how to translate those thoughts into actions that make the health implications better. Piece of cake, right? Again, I thank you very much for being here today. I'll turn it back over to Dr. Heckman.